to be a scholar, I think, is what we capture there is somebody who is an interested and interesting person, in that they have a comprehensive knowledge of many of the facets that make up life and many of the things that add to people's quality of life.
Being a scholar is part and parcel of professional life. We are lifelong learners, so we've got to be always renewing our knowledge, and we should know where to find the information, and we should know what information carries value and what is not. So analytical skills, being able to analyze articles that are out there, and being able to conduct research or write reports and improve on the knowledge base that is out there, contributing to science and to practice. Mm-hmm. So a professional that cannot be a scholar soon runs out of debt, and if you cannot engage in useful discussion with your colleagues, then you are likely not to even give the patient the right information. You are likely not to give the patient the most effective, affordable treatment options for them to make a decision. You are likely not to advise the patient adequately enough to make a decision if you don't have the information.
Being at school, getting a degree is not the end of the road. The healthcare provider being a long life learner. So being able to share information, being able to network information, being able to exchange information, and you cannot do that one without reading.
They're able to articulate that, and that's important when we come to some of the other facets of a health professional, which include probably the most important for me, which is that of advocate. Mm. And scholars must be able to articulate in a verbal way, but also in a written way. We also want our doctors to contribute to the evidence base for what we do. And so they have to record data, and sometimes they do have to write. We want academic articles, we want research articles, we want scholarly pieces, we want thoughtful, reflective pieces.
A scholar is someone who is knowledgeable about advances in research and who participates actually in research for the advancement of science in his discipline. So because medicine is not only an art, but basically actually a science, to be a scholar is important because medicine evolves. Either you contribute to the advancement of science, or at least you are acquainted with the recent progress in medical field. So science is important, and diagnosis, the methods, the approaches, the treatments, everything evolves. Epidemiology evolves, so the skills and also approaches of a health professional must take into account the recent advances in the area.
And part of being a scholar is to be a teacher. In reality, if you're giving patients health education or you're describing something to them, you're giving them information, you're helping them understand. And often doctors are the people who help people make sense of a puzzling world. Why have I got this particular complaint? Why have I got this symptom? And why now in my life? And sometimes for us as doctors, we kind of say, well, why not? In that these things have to understand. And so we're all called to teach and to train one another. And again, to as a senior medical student, helping a junior medical student to make sense of things. And we know that if you can understand early on in your medical career why you need to learn something that seems quite dry and quite boring, then it can bring that alive. And doctors aren't the sole teachers of other healthcare professionals, but they become part of a team that learn from each other. Yeah. And I think there's a danger in that doctors sometimes become the leads in healthcare teams, and that's not necessarily the way they should be, and they do it because they they imagine that they're the most superior in terms of knowledge and skills, or the most senior person because of their educational qualifications. But they need both to understand the learning and the teaching process, but also to understand the learning process. Because as a junior doctor, you probably learn more from senior nurses than you learn from anybody else. And in fact, as a junior doctor in a hospital, in the first year after graduating from medical school, your professional career is undoubtedly saved by judicious senior nurses who will say, "Doctor, maybe you should be doing this, or maybe you should be doing that." So I think we learn from each other all of the time. But certainly for doctors who believe in social and community medicine and community-oriented care and patient-centred care, then I need you to be teaching other healthcare professionals and other doctors.
So scholarly practice is part and parcel of any professional life, and would expect our doctors to come out with competences that enable them to be lifelong learners, and therefore it's better able to practice with current evidence, because the talk now is evidence-based practice.
For people. So there's very much a kind of teaching role and a health education role, and I hope that there is this thing that's often called the exceptional potential of the consultation, which involves the opportunity within consultations for saying to people, "Oh, and while I'm here checking up, or listening to your chest because you seem to have a chest infection, can I just remind you about your smoking, or can I just talk to you about this particular aspect?" So there's all sorts of opportunities there. Now, clearly, doctors as scholars are doctors who should be